Welcome to the all viewers and well-wishers of the world. The purpose of my lecture is learn the knowledge from the word and return the knowledge to the word. Motto of my life is learn, earn and return. I have learned a lot, earned a lot now to return a lot to the word. The topic of today is ganglion and cysts, or collectively it is called ganglion cyst. Ganglion cyst is a fluid filled swelling that develops near a joint or tendon. The cyst can range from the size of a pea to the size of a golf ball, that is about 2.5 centimeter. Larger ones can be around an inch, 2.5 centimeter in diameter, and ganglion cysts are non-cancerous lumps. They may occur in ankles and the feet also. Here one can see the ganglion cyst, mostly this area, wrist area, and here one can see that is in association with the different fingers and the wrist, and these are just present here anywhere in the hand. So ganglion cysts are round or oval and are filled with a jelly-like fluid. Ganglion cysts can be painful if they press on any nearby nerve, otherwise these are painless. Their location can sometimes interfere with the joint movement if they are in the joint movement, and that is going to restrict the movement because of their presence there. Here one can see it can be on the foot also, and then it can be on the different location in the hand and wrist. Risk factors of the ganglion cyst are that increased risk is with the sex and age. It can develop in anyone, but mostly in the woman of 20 to 40 years of age. Osteoarthritis, people with wear and tear arthritis in finger joints closest to their fingernails are also at increased risk. A high risk of developing ganglion cyst near those joints is seen. Joint or the tendon injury in past, these people are more prone to develop ganglion cyst, those who have got joint or tendon injury. Now, what are the symptoms of the ganglion cyst? Ganglion cysts look and feel like a smooth lump under the skin. They are made up of thick jelly-like fluid called synovial fluid, which surrounds the joints and tendons. Basically, it is just the leakage of that synovial fluid that leads to formation of the ganglion cyst. The, the fluid is to lubricate and cushion them during the movement, but the ganglions can occur alongside any joint in the body, but mostly on the wrist, back of the wrist, hands and fingers. Here one can see the actual cyst on the wrist and on the finger. So the symptoms continued. Ganglions are harmless but can be painful if they are lying on or pressing any nerve. If do not cause any pain or discomfort, left them alone and they disappear without treatment after many years. Reason why ganglion form is still not very clear. Synovial fluid that surrounds the joint or tendon leaks out and collects in a sac to make this ganglion cyst. And one can see the tendons and the bones, ganglion cyst between the two bones that just appear between these two bones. Now, how to diagnose? That is by the visual examination, by the ultrasonography, and by the CT scan and MRI that can help to confirm your diagnosis. So here one can see in the MRI the ganglion cyst. Here again on MRI the ganglion cyst can be seen, and the wrist MRI ganglion cyst can be seen by the radiology of this joint and the hand by MRI. It is said that beautiful people are not always good, but the good people are always beautiful because of their attitude and their nature. Now, what is the treatment of a ganglion cyst? Treatment is done only if the cyst causes pain or affects the range of the movement in a joint. The two main treatments are drain the fluid out of the cyst with a needle and syringe, and this procedure is called aspiration, and make the cyst out using the surgery. And sometimes cyst is removed for the cosmetic reason that it looks ugly at certain part of the hand which is not cosmetically good. So the aspiration, it is done under local anesthesia by a needle and syringe, that is to remove maximum content of the ganglion. The area is sometimes injected with a dose of the steroid that can prevent the recurrence, but this is still controversial. After procedure, a plaster is placed over the small hole in the skin that have been made by the needle, and here one can see the needle is just being put inside the ganglion, and that is going to aspirate the fluid and remove this plaster which have been put on that hole. After 6 hours, aspiration is simple and painless. First treatment option is the aspiration. It's less invasive than surgery, but 50% of all ganglion cysts recur, so the surgery is necessary in those cases where the recurrence is there. Here one can see the aspiration through the needle and a jelly-like fluid is coming out, and here that is jelly-like fluid that has been aspirated through this ganglion cyst. Then surgery, it have got two ways that can be used to remove a ganglion cyst. One is the open surgery, give medium-sized cut about 5 centimeter or 2-inch long over the site of the affected joint or the tendon, or the other way is arthroscopy, a type of the keyhole surgery where smaller cuts are made and a tiny camera called an arthroscope is used to look inside the joint. Now pass the instrument to remove the cyst as we do the lap chole or the removing the gallbladder through the laparoscope. Here is the complete removal of the ganglion cyst, and one can see the carpal bone and the stalk of the cyst, and here that is being made out completely in a one block, that is the ganglion cyst. Arthroscopy, as you can see, the small hole is made and through the camera one can see, and then through that canal one can use the instruments to remove the ganglion. Here again one can just go inside and see the location of the ganglion, and that can be removed by the arthroscopy. Open or the keyhole surgery, it is both techniques, what we do open or that, done under either the local anesthetic or the general anesthetic. Both techniques are equally effective at removing cyst and reducing the risk of the recurrence, and keyhole surgery is less painful and less invasive as compared to the open surgery. Here one can see the open surgery, the incision have been made about 5 centimeter, and that is just going to remove the cyst, and that is a cyst which have been removed in one block, and that is by the open surgery. And after the operation, put stitch up the wound because the large incision have been given, and put a bandage. It will keep it clean, reduce the risk of the infection, keep it safe from any accident, bumps, and the wound is not painful, but one can have painkiller if there is any kind of the pain. If the cyst removed from the wrist or the hand, wear a sling for a few days. That will help to improve the coming back to the normal, and to keep the arm safe from the accidental knocks and reduce the swelling and discomfort. Move the fingers regularly to help keep joint flexible. These are After the operation, surgery leaves a scar, may be thick and red. Skin around scar remains numb after the operation. Some bruising in the area after the surgery have been seen, but will fade quickly as the other bruises do. So, small possibility of a temporary stiffness, swelling, or pain due to the minor infection treatable with the antibiotic. Physiotherapy sometime may help, and the complications of R removal is a minor procedure, so the complications are not much and they are rare. Some experience permanent stiffness and the pain after surgery, but still they are rare people. If under general anesthetic, complication to the heart and the lungs, as these are the complication of the general anesthesia. And that is the end of the lecture, and I hope so and wish that you are going to subscribe my channel and would like my lecture and will just share it with the others. And still, if you have any question, you please do not hesitate to call to me at my numbers are given. And thank you very much for watching and giving the precious